Okay, lately there's been a lot of talk about, universal health care and what it can mean for America. And, up until a couple months ago, I didn't really know much about it. And I was even skeptical about it because I've heard some things in the past that, anything that's really government ran is bad, right? I've heard that, I've heard that many times. And, of course, I've naturally, shied away from it, I guess. But then my friend recommended I see a movie called Sicko, made by Michael Moore, and it was a real eye opener. It didn't win me over completely, but what it did, it allowed me to start really thinking about what universal healthcare can do for America and the situation that we are in now. So I looked around on the internet, read some information, talked to some people that actually live in Canada, live in Europe, that actually have universal health care, and they said that they really like the system that they have. I grilled them about any potential problems that they had, and they said they didn't really have any problems. And so glowing reviews all around. Granted, it was only a few people, but it was enough to make me wonder why are so many people in the country trying to smear what universal health care can do, and why people in France, Canada, Norway, Finland are worrying about us. And yeah, they're worrying about us and our system and how it's not doing what it's supposed to do. But you got these private companies. You pay these private companies a premium, and they find any little weasel excuse not to pay you. I mean, that's what a company wants to do, right? Is to make a profit and not lose a profit. They don't want to lose any money, because if they have to pay out a claim to one of their premium paying customers, then all of a sudden it's a profit loss. And what company do you know that wants to lose money? People make a company to make more money, and anyone that thinks that these companies care about people, they're just gullible or stupid. They don't care about the only thing they care about is the bottom line. So you got a lot of this going around America, and I'm wondering why can't universal healthcare be done in America? So first I want to talk about, before I get to anything else, what is universal healthcare? I mean, that just means what it is. You mean you get the healthcare when you need it. You don't have to pay for it because it's taken care of by taxpayer funds. And it can be, technically, socialist program, because it would be government ran and paid by taxes. And of course, to some people, that's a scary notion. That's very scary. Are they going to outlaw private medicine? No, of course not. I mean, private medicine and private insurance companies will still exist. They'll still be here. But universal healthcare will replace the bulk of that. So people get so scared about this, socialize that, and when in fact we have many socialized programs in America today. And like the police department, the fire department, the public schools, public library, public roads, the mail system, U.S. mail. You know what I mean? I mean, those are funded by taxpayer dollars and ran by some form of government. Okay, be it state or federal. Okay, both things make it a socialized program. And and so another program that's ran by the government and funded by taxpayers, that's the military. Believe it or not, that's right, that's the military. Some of you out there will be shocked that I'd even dare suggest that, but that's the way it is. It's ran by the government and funded by taxpayer dollars. And you know very well, we need the military, and we need the military to be at top notch. So we gotta do what we can to make sure that they're up on their stuff to keep us safe and at home and abroad. So I started thinking about that. Okay, well, why are so many people worried about socialism? And you're right. I mean, I was kind of worried before all this that we're turning to communist China or something. And when in fact you got universal healthcare in free countries like France, England, Canada, Norway, Finland. They're free countries. I mean, yeah, there's Cuba, but you know what? Cuba's a dictatorship, and Cuba does not have a real economy. And always when people talk about universal health care, they want to try to bring up Cuba. Cuba this, Cuba that. Cuba this, Cuba that. Cuba. Forget Cuba. Okay? It doesn't have a real economy and is ran by a dictator. Okay? You know, so you know, Cuba here doesn't really even count. I mean, yeah, in the movie Sicko, they use that as an example, and but technically, really, for me, it doesn't count. Okay, let's work about a country that's a free country, and you know, and it's not a dictatorship, you know, and has a real economy. So let's talk about those countries. Okay, so if we can just model or take the best parts of the models that they have and use them for America, and use them for our use, then that would make for a great system. I mean, of course, everything's not perfect. You know, people will probably have to wait, you know, up to maybe an hour or two for basic things at the most, like in Canada and France. But at least they'll have access to the healthcare. At least they'll have, you know, at least it isn't, oh, I'm sorry, you don't have no insurance? Get out. Sorry, we can't help you. Now, maybe under extreme circumstances of you actually about to die or something, like you got shot, yeah, they'll take care of you. But still, you know. But as far as private companies are concerned, to me, they're just a con job. They're just rip-off artists. They're just running a racket. That's all they're doing. I mean, you pay faithfully into the private system for years and years, and when you do get sick, they try to find some technicality and say, sorry, we can't pay you because you didn't check off this box here, you didn't dot the T over, cross the T over here, dot the I over there. Sorry, we can't. You're denied. You know what? We cancel we sort of flat out cancel your insurance. You know, and you know, thanks for giving us all that money, sucker. Thanks, chump. You know, private companies want to make money, and if they have to pay out these claims, then they lose money, and that's a profit loss. Companies don't want to lose a profit. That's why companies are made. So, well, you know, I'm thinking more and more that we should switch over to a universal health care that's tailored to what we need. You know, and that's not going to turn us into, you know, communist China, you know, France, Canada, you know, the UK, you know, Finland. You know, they've all proven that they're free societies, and they're still free societies. You know, they haven't turned into the Marxist nightmare that people, you know, fear. Are you crazy? Man, we have socialist programs in America today, and I already listed them off to you. You know, so what's the big deal? I mean, what are we waiting for? You know. Thanks for watching.